Emotional well-being is a critical factor that is often overlooked during treatment of cancer patients. But the breast screening program of the Barbados Cancer Society has been providing this support service for breast cancer patients for the past 5 years.
They're now called Bosom Pals, and they do a great job. They do counseling to the survivors and to their families if they need to. They would visit with them. They would go with them when they're having their surgery done, chemotherapy, and that's why they're called Bosom Pals. They become sisters. Who better to help you in a situation like that than someone who's walked the same road?
The ladies meet once a month and also speak with members of the patients' families. Medical coordinator Dr. Shirley Jagaru says this can make a big difference in their recovery.
They have socials together, and then they're able to talk to the families, and husbands and partners of those suffering survivors or those who've just been diagnosed. They work as a terrific group together and can make a difference to the family. Because, in our society, we have a matriarchal society. Whatever we say or do, and when the woman or the head of the house comes down with something like this, the whole family is devastated. So I think that the survivor group makes a difference.
There has been an increase in diagnoses in the past few years. The clinic recorded 59 new cases last year compared to 33 the previous year. Dr. Jagaru is encouraging regular checkups and self-exams so the cancer can be detected early.
Most of those cancers that were found within the last few years were early. Stage 1, stage 0. Now with that sort of detection, there's the definite better prognosis. It means that there are more treatment options and patients will be able to use that and will definitely do better. Their prognosis will be better. Because statistics show, one, for early detection, the breast self-examination is important. Now, more than 85% of women find these lumps themselves if there's a lump to be felt. Yes, not that all lumps are cancerous, but the fact is they found the lump and they would only find it if they're checking. And then you have that percentage that will be found with the mammograms, have absolutely no symptom, and that's where screening is important. There are no symptoms, there's nothing to find, but when they have the mammograms, something shows up. And it can be very tiny because it's not palpable with the finger, with the hand. Those patients do well because when we follow up the mammogram with biopsy, and we have facilities here to do what's called stereotactic biopsy, which is very accurate, and with that they're able to detect the cancer.
A recent development which doctors say will also contribute significantly to the emotional well-being of breast cancer patients is insurance coverage for reconstructive surgery at the time of a mastectomy.
So when you wake up from your surgery, you have breasts. It's really devastating to wake up and you find one breast gone completely, or a huge void in one because they had done a lumpectomy. Breast is one of women's sexuality and it's one of her beauty, You look at yourself and you see it's lopsided or it's absent. And I think the recovery period and everything will be a lot better. Statistics show that anyway.
Breast Cancer Awareness Month ended in October, but the disease remains one of the biggest health concerns for women.